Now, coming to the etiology or underlying causes which may predispose children to development of the osteochondritis dissecans. Although there is no exact one cause, and there is actually theory related to different causes as well, but predominantly osteochondritis dissecans etiology is broadly divided into actually three different reasons. One is hereditary, that usually these children have tendency that their cartilage becomes soft due to overactivity, and eventually the subchondral bone and cartilage actually collapses and moves out and leading to into a shallow kind of a crater. Or the other causes could be related to the traumatic cause, that for example, because usually these are children who are skeletal immature but highly active individuals, and mostly as more related with the pain and swelling after the activity. Therefore, there is a theory that probably the reason is actually the micro trauma which is actually happening during the playing activity, and continuous trauma or micro trauma over the same place for a longer period of time usually leads to traumatic injury of the cartilage as well as the subchondral bone, leading to osteochondritis dissecans. It's sort of a, you can appreciate, because usually the history is such that it does not develop over a single period of time. It's not like other injuries that patient had a pop or something like that and that patient was unable to continue his or her play. Usually there is mild symptoms, there may be no symptoms at all, and patient continues to go on for like, let's see, 4 months, 6 months. Sometimes, young adults who come with this problem usually complain that they had a problem in the last season, and now when this season has started, this problem is severely aggravated. So like it's kind of a disease in which they can carry on their playing conditions, somehow they manage it out, and once over prolonged period of time, around 4 months, 6 months, 8 months of time, due to continuous micro trauma which is occurring at that, this lesion usually develops. Another cause which in adults, which is more common, is usually vascular, and this has been seen morely towards the adult, because adults, as the vascular supply diminishes, the cartilage becomes loose and necrotic and eventually goes down and exposes the subchondral bone. Now this may be one of the pathogenesis or kind of involvement of etiology in the case of adults, usually less likely with the children. Mostly in children it's always either hereditary or traumatic, and in adults it's mostly the vascular which is the cause of the problem. Now coming to the pathophysiology, usually the most commonly problem starts with the cartilage. With first of all, it's always actually the softening of the cartilage. Why this softening occurs, underlying this could be hereditary causes, it could be traumatic, or underlying it could be a vascular issue as well. But first and foremost is always the softening of the overlying cartilage with intact articular surface. And now by this time the cartilage is only softened, it has not actually exposed the subchondral bone. From then onwards, there's early articular cartilage separation. As you know, the cartilage is on the top of a subchondral bone which is actually exposed, and as the cartilage softens out, it starts to move away from the subchondral bone. Now this is the second stage. Now once this happens, further reserve trauma, further causes such as vascular can aggravate the problem, leading to actually partial detachment of the lesion. Now what happens is that usually when this is happening, mostly it's always first of all the cartilage which is actually detaching and it's coming into the joint. But sometimes what happens is that instead of having only cartilage, some part of the subchondral bone also moves out and actually forms a large body or some in form of a actually osteochondral separation with loose body formation occurs. And this contains not only cartilage but some piece of the subchondral bone as well. And when this happens, this could be problematic because this loose bodies can produce symptoms which may mimic other problems like certain benign neoplasias. They mimic symptoms of locking and catching like with the meniscal injuries. Therefore, it depending upon at what stage it is, different type of symptoms and different type of problems are going to appear. That is why it's actually a kind of a disease in which The problem is with the cartilage and subchondral bone, but the clinical presentation may vary depending upon the stage of the disease. Patient may be mildly symptomatic or may present with only softening and effusion of the knee joint when there is only softening of the cartilage. This is very early on. But when this early articular cartilage separation occurs and usually partial detachment the lesion occurs, patient may have intermittent pain along with the effusion. And once the whole loose bodies are formed, the patient may complain of locking, catching, giving way, and all these sort of symptoms along with the pain and effusion, especially aggravated by the activity, patient may present with these kind of symptoms. So one has to understand that depending upon what is the stage and osteochondritis dissecans is, presentation of this disease can vary quite a lot.